So it's recording?
It's recording.
Okay. Hi, my name is John,
I'm Jocelyn.
and we're making this video with the, I think, hope that it could possibly help someone who is also going through a battle of cancer. I was diagnosed I was told that that they strongly suspected that I had cancer on February 28th of 2016, and that the type of cancer that I have is called multiple myeloma, which I had never heard of before. And about 4 or 5 days later, they confirmed that I do in fact have multiple myeloma. And we're hoping to just talk about our experience, and again with the hope that that will help others.
Yeah, I think we're just going to start right now with talking about what's happening now. I'm sorry about the mask. I have to wear this around John. When I'm in his room, I have to wear a mask and gloves so that I don't get him sick, and also so that he doesn't burn me, because his chemotherapy gets excreted through his pores. And if I touch him, like skin to skin, I could get burned.
That is a possibility. So yeah, we have to take precautions. That's why we're wearing the gloves as well. And part of that too, of all that, what was just described, is because of where we're at in this process. And 2 days ago, I received my bone marrow transplant, and that is the second one that I've received. This is my second transplant. This one is, I should know what it's called. But
Allogenic.
Allogenic, exactly.
It means it's from a donor instead of him donating his own stem cells. He donated his own stem cells the first time he had a transplant, and that was July of 2016.
Yeah.
So we're almost exactly a year, almost.
Yeah, that's true. I didn't even think of that.
Because you had your transplant on June 11th.
Right.
Yeah. So wow. Two
Yeah,
transplants in a year.
Yeah. The doctors that I saw thought that the first transplant would be the best route to go at that time, and unfortunately, it was, I'm sure. And unfortunately, though, 2 months later, the cancer returned. That was an incredibly disappointing time for me. Up till then, I had a very positive attitude, and that kind of took the wind out of my sails a bit. You know, it was then that I started to have more feelings of depression and hopelessness. So that was a tough time. That's been one of the biggest challenges throughout this whole journey, has been the ups and downs. Even in dealing with this current transplant, it was actually scheduled and postponed. Well, it was scheduled, and then it was, I was told that it wasn't going to happen.
It was originally, we're from Kansas.
Right.
It was originally scheduled in Kansas City, and then we found out that John's insurance won't cover a transplant from a donor unless it's in a clinical trial. So we had to come to New York City
to participate in this clinical trial, and that way I was able to get the transplant that I needed, and it would be covered by insurance. My understanding is that it is one of the most expensive medical procedures that there is.
I think it's
so
$800,000.
something like that's what I've read.
Yeah.
You know, so I don't take that lightly. I'm grateful that we're able to even be here and we're able to do it. And it's kind of ironic or interesting that we never would have planned things this way, but the way things have turned out, we're here at a hospital called Memorial Sloan Kettering, and from what we've heard, it's one of the best, if not the best, at doing this particular procedure. So we're very grateful for that. But going back to, yeah, it was scheduled, and then I received a call one day and was told that it wasn't going to happen. I can still remember where I was when I received that call, and it was like the bottom just dropped out, because I didn't even know that was a possibility, that it would be denied, but it was. So that's when the doctors suggested we look for a clinical trial, and they helped us, and actually highly recommended this one here in New York that we're involved in. And even though, and so then the one from New York was actually scheduled for March 20th as an admission date, and that got postponed. Then my actual transplant that happened 2 days ago was postponed by a day, and then it was postponed by 20 minutes, and it's just been it's been trying times. There's been a lot of emotional ups and downs with all of this. And, you know, we didn't know heading into this. This is my first time, personally, dealing with any major medical issue. So that's another reason I wanted to, with Jocelyn, make this video, because going through it for the first time, there's a lot of stuff that a lot of people may or know or just take for granted that I had no knowledge of. And one was the ups and downs of what can happen. So, and I'm so grateful to Jocelyn, to have her by my side throughout this whole thing, because she, I guess you could say, unfortunately or fortunately, does have a medical history, and she has dealt with a lot of medical issues, and
the reason I'm able to take care of him is because I was born with a congenital heart defect. I have a 2-chambered heart instead of a 4-chambered heart. I've had 2 open heart surgeries. I have a pacemaker, and I've had it replaced. I have congestive heart failure, and I got on disability because I was in stage 3 heart failure. So I'm on disability, but that gives me the opportunity to be here for John.
Right, Jocelyn fulfills really 2 roles. 1, she's my girlfriend, and 2, she is my caretaker. That was something that early on I learned about, that when it comes to going through a transplant, you have to have a caretaker, 24/7 caretaker. And a lot of people in my life, I'm sure, would have been willing to do that, but wouldn't be able to. You know, I look at somebody like my sister, for instance. She has children, she works. It's just not even an option, you know. So I'm very fortunate that Jocelyn is in a position to be able to do that, because when I first heard of that idea, the fact that I had to have a 24/7 caretaker, that was overwhelming to me, because I thought, who could do that, you know? Who would want to do that? Who could do that, you know? Hey!
So we're kind of doing these videos with like the experience for a cancer patient, and also the experience through the caretaker's eyes. As a caretaker, there's, besides the obvious that you have cancer, there are some things that have been really hard. The disappointment of, you know, having the transplant scheduled and then canceled and then scheduled and then canceled, is really, it really was hard. Another thing is, when I'm here in the hospital, I feel selfish doing this, but they actually encourage me to get out of the room and go.
Oh.
Okay. Go ahead.
No, we had a little interruption. That's something I've had to learn. I didn't know that, you know, it's just kind of part of being in the hospital is someone just had to come in and take my vital signs. So I've learned that, you know, I'm woken up at 2 in the morning, 4 in the morning for vital signs, to draw blood. That's just part of life of being in the hospital. We're currently, week and a half or 2 weeks into a 30-day stay in the hospital.
Tomorrow will be 2 weeks.
Tomorrow will be 2 weeks, okay.
Yeah.
Because with the two different types of transplants, there are different regimens. They both involve a 100-day process. But with the auto, where I donated to myself, we stayed near the hospital. And I didn't have to, I only had to, did I have to be in the hospital? I had to be in the hospital about what?
4 days.
4 days at the very beginning. Whereas with the, what's it called?
Allogenic.
Transplant that we're currently doing, it's also a 100-day process, but the first 30 days are in the hospital, and then we will transfer to a location near the hospital.
Yeah.
And that was another thing, is during this 100-day period, you have to live within a certain radius of the hospital, because through most of my treatments and my first transplant, I think my fever spiked. Well, no, one of my it doesn't matter, but my fever spiked, and once it reaches 100.5, then you have to call the hospital or the doctor immediately, and they're generally going to say, okay, go to the hospital right now.
Right.
That's why you need to live within a certain radius.
And so right now, while we're in the hospital, the doctors and the social workers and everybody are like encouraging me to go out, learn, the ropes of the city, kind of get oriented, and try to take some time for myself, because at the end of this 30-day stay in the hospital, I'm going to be the 24/7 caretaker.
Yeah.
And what that all entails is they give you a big notebook and tell you how to prepare food specifically. The first time we got that notebook, it was like a 3-inch binder.
Yeah, we actually also received a class.
Yeah, it was a 3-hour class.
Yeah.
With that huge binder. And when I took it home, I was just like, honestly, my first thought was, I'm gonna kill him.
Oh no!
Like inadvertently,
Still here.
Luckily. No, but like there's so many things, have to wash all the tops of, like if I give him a pup, I have to wash the top of that.
Right.
I have to basically wash everything he's going to touch, everything he's going to ingest.
Yeah.
And also everything that comes out. If he gets sick, I have to go through and look for pills.
Yeah, thankfully we haven't come to that. Although I have gotten sick, we haven't had to do that.
Yeah.
Yeah, there'll be times where we had to measure everything that's coming out, keep track of it. Keep track of what goes in and what comes out. That can be a bit of a chore.
Yeah. So basically, at the end of the 30 days, that's what I'm going to be doing. I have to wash his clothes every day, his sheets every day, wipe down everything he touches, everything that I touch. But I'll be able to take off the mask.
Right, which will be nice, I imagine.
Yeah. I actually, before I came here, I got my days pierced because I was getting migraines all the time. And when I got here, I started getting headaches again, and the nurse said it's because I'm rebreathing my carbon monoxide basically all day. So that's another reason they've encouraged me to get out, is to take care of myself. I feel really selfish whenever I do that.
I don't think you should.
I just, I want to be here all the time with him. It's really hard to leave. But it's also hard to stay. Because I'm extremely extroverted. And
she needs to be around people. That's how she gets her energy. And
yeah. It's just nice
I'm
to
kind
talk.
of fortunate for this situation. I'm very introverted, so. But it doesn't make it it doesn't mean it's an easy ride for me either.
Yeah.
And I want to mention too that, like, even little things like the fact that this string was actually chafing her ears, and she, what the nurse?
Yeah, gave me like these foam things. So
Yeah,
it
you
makes
could
my
put
ears
around the
like
string.
Dumbo.
Yeah, oh no, I wouldn't say that. Yes, my little tiny cute ears.
Aw, thanks, darling. Aren't we cute? We're good. We're good. Yeah, so I do feel selfish when I leave, but I'm
Well,
encouraged to do so.
Exactly.
Um,
And you did so tonight. You went and did
I
something
did.
that was taking care of yourself, and I think it really
Yeah,
was beneficial for you.
it
And
was.
I'm really happy. I'm happy that you did that. You know, I'm
Yeah.
glad. Because I want you to, you know, that's the thing. I may be the one with cancer, but we're both going through this journey, you know. If the roles are reversed, I can only imagine, you know, what I would be dealing with as far as people. I don't know what I'm saying. As far as something else just popped up on the screen that distracted me.
Mhm.
But as far as having just being from the caretaker point of view, I can only imagine the challenges that there would be.
Yeah. A lot of challenges of being a caretaker is it's really hard to see someone you love going through this, and knowing that there's nothing you can do besides be there for support. It's really hard to see him struggle with the nausea, not being able to eat,
Yeah.
pain, the constant pain.
Pain, nausea, fatigue. Those
Yeah.
are the three big ones that I would say I've been dealing with on some degree or another since this began. I've been fortunate in the last year that during non-transplant times of my life in the last year or a couple months, where I've still been receiving treatments, but they were treatments where I was still able to work. I was very grateful for that. But during those times where I was working, again, pain, nausea, fatigue, those were the three main things that I always had to deal with. And it gets frustrating, you know. If for me, I'm a person who, prior to this, the only medication I took was over-the-counter stuff for migraines, you know. So now I'm on a whole regimen of medication, you know, and it gets frustrating because I'm on the original medication to treat, say, nausea or fatigue, and then or it'll be part of the treatment possibly, like the steroids are a big one.
Oh my.
Yeah, steroids, and then all of a sudden I'll need more medication to deal with the side effects of the steroids, and it gets complicating. And steroids are another thing that I'd never dealt with before, and I was not really, I didn't know what to expect, and obviously they kind of amped me up at times, maybe a lot of times, and
I'm just thinking about the sign thing.
oh right, yeah.
Okay, when he first started treatment, he would take what, like 40 milligrams?
Yeah,
steroids
exactly.
every Friday?
Dexamethasone.
Dexamethasone.
Right.
And I remember we were waiting in the doctor's office for the treatment, and you said something like, well, I can't do this every week. I'm just gonna have to tell him just to work around my schedule. And I just said something like, you know, if you do that, they will not keep your appointment. And so he said, well, I'm just gonna get a sign, and I'm gonna go down to the Lawrence Journal World and protest. And I was just like, oh my gosh, calm yourself.
That's an example of my great ideas of how to deal with things.
Yeah.
Thankfully, it didn't come to that, and it didn't come to that, thankfully.
Yeah.
So, but back to the steroids, yeah, dealing with the feeling amped up, not being able to sleep, and then a voracious appetite at times. I packed on 30 pounds, it seemed like, in an instant. There was one other thing about the steroids I can't remember right now. And that's another thing, with all the medication and all the chemotherapy. I mean, I've essentially just about been on chemotherapy for, solid for, a little over a year now, to one degree or another. If it's not in regards to a transplant, it's in regards to treatment. And
Do you want to talk about the gene thing?
yeah, in just a second.
Oh, sorry.
That's fine. But, it all, I've had experienced forgetfulness, I've experienced confusion, I've experienced hallucinations, a lot of stuff that I'm just not used to, and it's, so that can be challenging as well.
The hallucinations were kind of scary.
Yeah, that was a little scary. That was scary to me. That was the real deal, where I really was seeing things that really were not there. Thankfully, it was just a couple of minor incidents, and it passed. It didn't turn out to be anything more than that. And then what did you mention just a second ago? I'm sorry.
The gene, your gene.
Oh, yeah. I've learned that the reason that, because I'm actually young to have multiple myeloma. A lot of people who get multiple myeloma are more in their 70s or 80s, and I'm 53. So for this disease, that's young. And it's twofold. I'm young in regards to this disease, so I can have the strength to fight it. But the other side of it, one thing we learned is about a gene that I have, or actually I'm missing half of the gene, and it's the gene that would fight this in my body. So unfortunately, I'm also at a high risk for it to return.
Yeah, with the first treatment and transplant, they said, we'll do this now,
Right.
and we expect within a year and a half or 2 years, it will be back.
Yeah, that is true.
And actually, for the first treatment, I read your file, because
Yeah.
I'm sneaky, and hey, I'm stubborn, and if I have a question, I'll find it out.
I believe that. I'm thankful to have a good advocate, very good advocate, because I'm kind of sometimes not too good at advocating for myself in this situation. So.
And I'm the annoying girlfriend that asks every single question.
That's true, and
Over
it's
and
a
over
blessing.
and over again.
It's a good thing. Doctors and such may not always care for it. Now they do. We've been very fortunate that all the staff that I feel like we've dealt with has been very supportive, and they're always open to questions. It's been so important to, as we think of things, like let's say if we have a weekly visit, then throughout the week we write down in a notebook the
Right.
questions that we have, and then we take them into our visit. That's been very important, because otherwise what would happen is I end up going to the visit and I don't ask my questions, and sure enough, as soon as they'll ask at the end of the visit, do you have any more questions? And I'll be like, no. And then we leave, and on the ride home I'm thinking of five questions,
Yeah.
So it's been very beneficial to write those down. That's been very helpful.
But through my stubbornness and tenacity to find the truth,
I like the way you worded that.
I read your chart, and you were never in remission after the first one.
Oh, really?
Yeah.
Oh, interesting. Yeah. See,
So it never went away.
I didn't know that. There's a lot to learn.
There is.
I personally avoid the internet.
Oh God, avoid interwebs. They're horrible.
Yeah, I think I'm sure there's a lot of great information out there. I try to rely on what I hear from the doctors, and from the medical staff, as opposed to, in the beginning I got on the internet, and, it just brought up a lot of fear, basically. Just brought up a lot of fear. I mean, that's where I learned, they kept saying in the beginning, they just said it's very treatable, it's very treatable. And it was on the internet that I learned that it's incurable and it's terminal. That's multiple myeloma. That's the hard truth of multiple myeloma, is that it's incurable and it's terminal. And so, but it is very treatable. And I've learned that means, it doesn't mean, it means I have a number of years ahead of me, That's the hope. I mean, it could be, the reality is it could be 3 to 5, you know. My hope, obviously, the hope is that it's much longer than that. And that's been a challenging thing for me to face, you know. It's facing mortality, and that's, I'm not even going to begin to, you know, first, and I also want to qualify all this.
Sorry, we got interrupted again.
Part of the deal. So yeah, I wanted to also qualify this tape by saying we are in no way trying to pass ourselves off as any kind of medical advisor or experts on anything. I'm not going to try to go into some philosophical conversation, metaphysical conversation about mortality. I know that I've learned to take advantage of every support that I can get. For instance, during my stay here at Sloan Kettering, you know, I've spoken to a psychiatrist, I've spoken to a rabbi, I've spoken to a social worker, and I've done some music therapy, some massage therapy, and I'm grateful that all of those resources are provided and are available to me, and it's been very beneficial to take advantage of them. And that's important for me to say, because I'm a person who, prior to all this, always thought, you know, oh, I can do it on my own, I can handle it, you know, and, you know, I got to do everything on my own. I had that kind of attitude, and I've had to let that go, because I can't do it on my own. So I'm grateful for all the support that is around. And like I say, we're in no way experts. We're just here to just share our experience, and hopefully maybe it will help somebody out there.
Yeah.
Do you have anything else you'd like to say for now? I think I'm about talked out for the moment.
Yeah, I'd like to say that we're also gonna like try to videotape normal stuff. Like, just because you have cancer doesn't mean life's over.
That's true. Yeah, we've had a lot of laughs.
We had a lot of laughs. Probably at the most morbid or
Right.
the weirdest
Inopportune
things in the
time,
world. But you can still laugh. You can still make memories.
Exactly.
You know. So yeah, we just wanted to start this.
Yeah, as a couple, I feel like we've had some of our, you know, best moments so far, and we're going to create more.
Yeah, he actually got diagnosed 2 weeks after we started dating.
That is correct.
But we'd been friends for 4.5 years.
Right.
So I don't have a Florence Nightingale complex. I'm totally, you know, I wanted to be his caretaker because
Yeah.
I love him.
And I told her at that time, I said, you know, you didn't sign up for this, and there's no hard feelings, you know, if you want to move on.
And I said, you didn't sign up for this either.
I'm grateful. That's true. And I'm grateful that she's still here.
You're pretty special.
So are you.
So anyways, thanks for listening. We hope it helps.
Yep, and we hope to, like I said, do some more recordings and add as we go on our journey.
And sometimes if John's not feeling able to speak, it'll just be me.
Yep.
Or maybe if he wants to do something by himself, he could.
Yeah.
So anyways, thank you for listening.
Yep, thanks.
And have a good night.
Take care.
Bye.